Live and on air and everything there. Okay. So good afternoon, everyone. I'd like to remind everyone that our meetings are web streamed and televised, and would ask that you ensure your phones are on silent mode and mute yourself when not speaking. And of course, remember to unmute yourself if speaking. For those attending virtually, please keep your camera on and please use the Microsoft Teams raise hand feature icon to be called upon and to remove it after you have finished speaking. We begin today with the Board of Health meeting and will proceed to the public hearings meeting at 3 p.m. once this meeting concludes. Public hearing meeting begins at 3 p.m. With that, I call the Board of Health to order and welcome all members to the meeting, including the mayor. Now, I remember the other day watching Carmen Sandiego with my grandson. So where in the world is the mayor today?
It's a mystery.
So the agenda, we have one amendment to the agenda to add the Board of Health minutes from March 1st, 2022. Could I get a mover and a seconder for the agenda? Or are there any other amendments anybody has for? So Councillor Taylor moves, Councillor Huffman seconds, all in favor? That is carried. Any disclosures of pecuniary interest? Seeing none, we have our presentation from the Medical Officer of Health. So I will turn it over to Dr. Strauss.
Thank you, Chair Van Passen. Always a pleasure to update the Board of Health on the Public Health Unit's activities. On this occasion, you'll find attached to your agenda my report that I delivered to the Health and Social Service Advisory Committee because that was just a week ago. So I haven't updated the written report. Verbally, I can include a few updates. So the burden of disease, COVID that is, in our community remains quite low. This morning, I received our kind of daily hospital system status report. There are 6 residents of Haldimand, Norfolk currently in the hospital with COVID-19. There are 0 residents of Haldimand, Norfolk in the ICU currently. I have reviewed short clinical summaries of those 6 patients who are in the hospital, and as best as I can tell, you know, not being at the bedside, but based on these short summaries, it seems that all 6 are in the hospital and they're with COVID and not because of COVID, so that either they were in the hospital for some other reason and incidentally got COVID in the hospital, or they came to the hospital for some other reason and happened to test positive on arrival. So all that to say, the burden currently in our disease and for our acute care sector appears to be low. It is now anticipated that the BA2 Omicron variant will become dominant in Ontario. This variant is potentially, probably, more transmissible than original Omicron. We could see a rise in cases over the coming weeks on that basis. And sorry, that statement's a week old. We have seen a rise in cases locally at this point. BA2 is not thought to cause more severe disease than the original Omicron, and it is not anticipated that our healthcare system will be overwhelmed by this rise. At the last Board of Health meeting, I discussed the difference between urban and rural experiences throughout the pandemic, as well as our relative performance with respect to COVID mortality compared to some comparable regions. I did update the advisory committee along those same lines, and I've included in the agenda package updated figures that we looked at last time. So I won't go through those again, except to say that the previous trends continue to hold, and Haldimand, Norfolk is continuing to do very well with respect to COVID-19 mortality. In order to keep mortality low, my chief priority is to make sure that vulnerable individuals, that is elderly or unvaccinated folks with medical problems, get tested for COVID-19 so that they can qualify for the new treatment, Paxlovid. Paxlovid needs to be given as before severe illness sets in. So if you're going to the hospital because you can't breathe, it's probably too late to take Paxlovid. Paxlovid needs to be taken within 5 days of symptoms starting at all. So in a recent randomized placebo-controlled trial published in the New England Journal of Medicine of Paxlovid, they saw 0 of 389 patients who received Paxlovid die, whereas 7 out of 385 patients in the placebo group died. That's a 100% decrease in death. I've been an ICU doctor for 10 years, as you well know. My whole career is about giving folks medicines to prevent them from dying. We do not see medicines come around that are 100% effective at preventing death ever. So this is incredible. This is an amazing medicine. The paper I've just quoted for you was very well done and is published in the most prestigious medical journal that exists. Hospitalizations in that trial were markedly decreased. They were decreased by 90%. So not only does the medicine save lives, but it saves the healthcare system a lot of angst. It is my belief that early and easy access to this medication could significantly reduce the local burden of COVID-19. And I've been a little bit out of my tree over the last week because it is my understanding that the province has 40,000 doses of this medicine, or 40,000 courses. It's given twice a day for 5 days. But there are 0 courses of the medicine available in Haldeman, Norfolk at present. So I've been going to all sorts of meetings with as many officials and administrators as I can to figure out how we rectify the situation, but this situation needs to be rectified. And that will be, I think, the mainstay of my work for this week as well. Oh, there's something else. Oh, and I guess the last update is just to say I just received word this morning that the National Advisory Committee on Immunization is recommending that health jurisdictions prepare to deliver a second booster shot. So I have not yet reviewed the full text of the package that they've released, just a recommendation so far, but I guess that should be on everyone's radar that for the most at-risk groups, folks over 80, folks in long-term care, the recommendation to deliver those second doses will probably be made soon. So the health unit will, of course, be preparing to operationalize that as well. Those are all my updates, and I'm very happy to take your questions.
Thank you, Dr. Strauss. Are any questions for Dr. Councillor Van den Driesche, or Board Member Van den Driesche? Sorry.
Turned on now. Okay, thank you. Through you, Mr. Chair, to the doctor, the booster shots, you've indicated that would be like your 4th needle shot. But the 3rd shot, how many do we have in the area that have received a booster shot?
I can check that on our website. I don't keep the number, the up-to-date number in my head at all times. If you want to hang on. Oh, actually, no, it's not on this page. I'm more familiar off the top of my head with the provincial numbers, which is about 50% of all eligible.
Right.
I reviewed our local numbers, but not I haven't memorized them.
So I'm just wondering, are we doing any sort of program to encourage those to get their booster shots, such as just to encourage like teachers, nurses, everybody to get their booster shot? Is there a program for that? And the elderly, is that still considered fully vaccinated as 2 shots or 3?
So you're asking a little bit of, I think, a question about the language surrounding how many shots you've had. We have been advised by the ministry to adopt the language of up to date. So one is up to date on their vaccinations or not up to date on their vaccinations. So officially fully vaccinated still means 2 shots, but we are moving towards the phrase up to date for 3 shots if you qualify, 4 shots if you qualify, probably 5th shots if you qualify.
So when you say qualified, I'm just curious for your 3rd shot, who would be qualified for a 3rd shot?
All adults are qualified for their 3rd shot. And all adults are qualified for the 3rd shot.
All adults, right. Okay, exactly.
All adults are qualified for their 3rd shot. And then immunosuppressed adults are furthermore qualified for a 4th shot currently. And that's likely going to go up to 4 and 5 in the coming weeks to months. And all of those efforts to continue to encourage vaccination, which I've enumerated at several previous meetings, are still underway. I do think that socially speaking, at some point it does end up being pushing a rope. Like the rates of new vaccines going into arms all over the province, all over the nation are down. So I think that it is the case that most people who what would I say? Many people who have chosen not to be vaccinated at this point are quite entrenched, and it's unlikely, I think, that new programming initiatives are going to change that now a year and a half after the vaccines having become available. And that's, I'm not happy about that, but that's just the reality of the situation. So whereas it seems to me like the Paxlovid issue is 100% effective and is not available currently. So I think there's a lot more juice to squeeze.
I just like the next question then to be about the situation of Paxil.
Mhm.
Since there's only so many doses or rounds that they have to have, I think you indicate something like 40,000 for the province. How do we get our fair share down here? How do you go about making sure that our residents have the opportunity to get this particular drug to assist them in their illness? How do we get our fair share sort of deal is the question.
Yeah, so I'm trying to answer that question myself because I think that this is unanswered. Right now, it is available to Halton and Norfolk residents, and I tried to make that clear because it's worth it to drive to Hamilton or to Kitchener, which are the closest places where it is available. So there are COVID assessment centers at Hamilton and Kitchener who have the medicine. Your family doctor can refer you there. Any doctor can refer you there. I will refer you there if you call the public health unit and say that you qualify and have a positive test. So, but that's an hour to an hour and a half drive for some of our residents, and I don't think it's fair at all to ask somebody who is elderly with multiple medical problems and under the weather with COVID to drive an hour and a half. I think I would like the whole community to advocate with me on this point that we need to get it down here, and we need to get it down here pronto. I have met with, like I say, government representatives, ministry representatives, hospital representatives, local family doctors, the family physicians who I've spoken with. Many of them I've come to know over my 8 months in the community. They're very well educated. They're very motivated. They're very on the ball. They know that their patients need it. They know how to give it, and they are not understanding what the holdup is, and I am not either. So it is my intention to write a letter to the Minister of Health later this afternoon on this issue, and I hope that it is
well, if there's anything we can do, I'm sure we will be supporting that, because I think we should end up with our fair share down here to make it accessible to those who need it in our county. So thank you.
My pleasure. Thanks.
Any other questions for the Councillor Columbus? Member Columbus.
Thank you, Mr. Chair. And Dr. Strauss, just to follow up on that, to get the drug Paxlovid, do you have to be symptomatic and
yes,
get a prescription from your doctor? You just can't get it anywhere then. You have to be symptomatic.
So this is my concern, is that my understanding is in Quebec, Alberta, and British Columbia, your doctor can write you a prescription, and then you can go to, it's not every pharmacy necessarily that'll have it, but then you can take it to the correct pharmacy and get the medicine. Currently, that is not the case in Ontario. There was really an excellent article in the Ottawa Citizen about a relatively young woman who qualified because she was immunosuppressed for her rheumatoid arthritis, and her doctor wrote a prescription, and no place would honor it. And there was some difficulty getting referred. So they do actually have the drug in Ottawa, so they're a step ahead of us. But so it seems to me, and I was told last week that in the next few days, which was a week ago, community pharmacies would start stocking it, but that has yet to happen. So it does seem to me that it would be best if your doctor could write you a prescription, you could take it to your pharmacist, and that pharmacist could fill it. And as of yet, it hasn't been explained to me why that isn't the case here.
Is there anything the Board of Health here can do to try to help you speed up the request to get some of that material in our Halton Norfolk Health Unit region?
Thank you for the question. My expertise is in medicine. The medical issue is very clear. If you qualify for this medicine, you should have it. And it seems to me that it is, frankly, it doesn't seem like a supply issue. So the province has 40,000 doses. Only 800 in the province had been distributed at the time of that Ottawa Citizen article last week. So it seems like a logistic, administrative, perhaps political issue. I don't like, it's not quite my expertise in terms of how to lobby the government effectively, but I do wonder if a motion from the Board of Health, and if there was such a motion, I would certainly include that in my letter this afternoon. But it is perhaps rather more your expertise than mine how to be effective on this point.
I think that's a good answer. I think we should put a motion forward to help you out, to accompany your letter. Thanks.
Any other questions? Maybe our medical officer health is still available. We could discuss a little bit a type of motion that would be required, something along the effect that the Board of Health supports the efforts of our medical officer of health in making Paxlovid available in Holloman, Norfolk. Is that what you were thinking, or Member Columbus?
Yes, I would. I think that's pretty straightforward for the Holloman Norfolk Board of Health.
If I could impose on the deputy clerk to sort of write that up for us.
May I make a small interjection, Chair Van Passen?
That's why we still got you here.
Oh, maybe perhaps to make it locally available, because it is technically available if you're able to drive to Hamilton or Kitchener with a referral from your doctor. But I think it should be locally available, because there's no reason to drive an hour and a half when it could be at your community pharmacy.
Thank you. That's why we lean on your expertise.
Through the board deputy chair to the board, I have drafted that the Board of Health support the medical officer of health through providing a letter of support and making Paxlovid locally available in Holloman, Norfolk.
Member Martin?
Thank you, Chair Van Passen. Looking for maybe a friendly amendment from Member Columbus to CC that letter to our MPP and MP as well, if this is potentially something that they can additionally help lobby with. I think that this letter should be circulated not only to the ministry, but our local representatives.
Perfect. Thank you.
And are you also seconding that motion then, Member Martin? Now, Mr. Clerk, should we deal with receiving the report as information first and then do that motion, or?
Through the board chair, you may do it all together, or if you wanted to separate the motion, that's the prerogative of the board.
Well, then we'll deal with the motion that is on the floor, which is the letter of support. Any discussion on the motion? Seeing none, all in favor? And that is carried unanimously. And then could I get a motion to receive the update and report from the medical officer's health as information? Moved by Member Taylor, second by Member Rabbits. Any discussion? All in favor? That is carried as well. So thank you, Dr. Strauss, for your report. And we will move on to our next item on the agenda.
Thank you.
Is staff report, HSS 22-005, the 2022 annual service plan and budget submission. And we have Heidi Van Dyke to lead the presentation.
Thank you, Mr. Chair. I would like to invite Mr. Syed Shah to present the report for you this afternoon.
Thank you, Heidi. Through the chair to members of Board of Health, first of all, I would like to thank you for giving me an opportunity to present 2022 Annual Service Plan and Budget Submission Report. This report is to advise Board of Health on the submission of Annual Service Plan and Budget Submission to the Ministry of Health and request that Board of Health endorse this submission. To give you a brief background, the Ministry of Health requires submission of an annual service plan to accompany the request for funding for mandatory, related, and one-time programs. The objective of annual service plan is to communicate program plans and budgeted expenditure for a given year And secondly, to describe the programs and services in detail which Board of Health are planning to deliver in accordance with the Ontario Public Health Standards based on local needs. As was the case in 2021, due to COVID-19, Ministry of Health scaled back on annual service plan template and only requested financial sections of the annual service plan. Additionally, the Ministry of Health is also providing health units the opportunity to request one-time funding to support COVID-19 extraordinary costs, referred to in this document as COVID-19 General Program and COVID-19 Vaccine Program. The Ministry of Health has committed to public health units with funding to offset eligible costs associated with the pandemic. Public health units will have an opportunity every quarter to update the Ministry of Health with their local needs. Similar to 2021, the Ministry of Health did not provide an opportunity to request additional base program funding. The submission was limited to 6 specific one-time funding requests, and which excludes COVID-19 general and vaccine programs. Health unit staff included one-time requests based on local needs, strategic priorities, and reducing the municipal levy contribution. In summary, there are 3 heads for our submission. The first one is base funding. So for under base funding, the total budget submission is 9.241 million, which includes 8.7 million for mandatory programs and $537,000 for Ontario Seniors Dental Care Program. For one-time COVID-19 funding requests, the total submission is $4.5 million, which includes $2.688 million for general program and $1.81 million for vaccine program. For additional one-time funding requests, the total submission is $310,000. It is important to mention that this ASP does not include programs funded by the Ministry of Children, Community, and Social Services. So once the Ministry of Health has communicated the approval of this annual service plan to the amending agreement, a follow-up report will be presented to Board of Health for approval with base or one-time budget adjustments requiring a budget amendment. With this, I'm happy to answer any questions. Thank you.
Okay, thank you. Are there any questions from board members for staff? Board Member Martin?
Thank you, Chair. Through you to staff. My question is specifically related to the chart on page 8 of 12. The mental health and addiction service, there's a 1.0 FTE request, $124,200, and then there is an additional women's health services 1.0 FTE request, $124,200. In my recollection, these programs have previously, under this term of council, seen reductions. So I guess I'm just seeking some clarification as to why they're being added on. You know, is the program needed or is it not needed? Is this in addition to something that's existing? If we could get a bit of a refresher, what's currently running in those programs, that would be appreciated.
Thank you. Through the chair to Councillor Martin. So first of all, I'll go through mental health and addiction services. So this is the request we put to Ministry of Health, and this is kind of a pilot project we are trying to work on with the support of Social Services Division. So it would be a collaboration between the health unit and the homelessness program. So when we were discussing with the homelessness prevention program, so we saw that there is a gap of clinical services within their homelessness program. So so just to give you more details, so when the staff, they receive a person in their shelter, there is no one to support clinically in terms of referral, in terms of assessment, or in terms of proper clinical assessments. And the agencies which are like, there are agencies outside available, like mental health addiction services, they take a lot of time to deliver those services. So that's why we included to have one full-time FTE to bridge that gap between social services and home to bridge that gap within the homelessness prevention program. And that would be one of the pilot programs within Ontario. I'll let Heidi to add further details.
Yes, thank you, Syed. And through you, Mr. Chair, to Councillor Martin, through the Health and Social Services Division, we have been looking for opportunities to provide more integrated service to our community, particularly our most vulnerable. And so through this pilot project, we are trying to partner our Ministry of Municipal Affairs and housing-funded homeless prevention program with Ministry of Health funded public health in order to build a cross-functional team to respond to our homelessness population, particularly those who are experiencing mental health and addictions. So we do see this as a pilot project where a public health nurse would work with the homeless prevention services team, particularly those individuals who are unsheltered or who are in emergency housing and may be the farthest away from primary care in our community. So we often support people who don't have family physicians, who are perhaps frequent users of the emergency department in the hospital. And so our hope is that we can have a one-year pilot project to build some data around the effectiveness of responding to homelessness using a health and social services cross-functional team, and also being a leader in rural Ontario in this kind of integrated initiative.
Thanks for that response, Heidi and Syed. So building on that a little bit more, when would this pilot project be reviewed? At what point in time does the funding, if we're successful, change over to becoming a part of our budget? And additionally, what do we have concerning public health nurses for mental health work in the health unit presently? Is this, an additional staff that we're adding to a team, or is this a lone ranger coming in to work through this?
So, Mr. Chair, through you to Councillor Martin, this would be an additional public health nurse to the substance use team. So substance use and harm reduction is a mandatory part of public health programming. And so this would be an additional dedicated resource funded by the Ministry of Health in order to support this pilot work. We would be working with the data team and the program evaluation team at the health unit to identify the measures of success, and we would be keeping track of those throughout the year, so that we would be poised to be in a position to advocate for permanent funding going forward, should this pilot be as successful as we anticipate that it will be.
Okay, thank you for that. And then could we go on to the 1.0 FTE for women's health services? And I think all of the same questions apply there.
Yeah, thank you to the chair too. So access to the health services in Haldimand and Norfolk has historically been a challenge for all residents. Like if we look at our indicators, so we have 58 physicians in Norfolk and Haldimand per 100,000 population. This compares to a Canadian average of 241 doctors per 100,000 population. This is just one of the indicators. But there are reports that COVID-19 epidemic has a significant impact on already vulnerable population, especially on women. And there are instances like, for example, I can quote that, for example, in Norfolk General Hospital, the maternity ward has been closed down. And we are seeing a higher impact of this on the woman's health. So and this is in consultation with the medical officer of health, that women's services, they are available, but they are scattered in different areas. So what we are proposing to have some kind of collaboration and kind of an integration to include all the stakeholders to provide increased accessibility to in terms of like health services and education to all the women in our area. So that's why we are proposing to have one FTE to coordinate and help us integrate all the services which are available in Haldimand and Norfolk.
Okay, thank you for that. So to clarify, the Women's Health Services is not a part of a short-term pilot project?
No, it's not. But that would be only for 1 year as because it's one-time funding request for 1 year as part of annual service plan.
Okay, thank you very much. I guess the final question, I'm in support of both of these positions. I think given COVID, they've only additionally amplified the need for these services in the community, but the need was already there prior to COVID. I guess the question I'm kind of scratching my head on is I know specifically this term of council has made reductions in both of those areas. And so what I'm hearing today is that the need has never actually gone away, and dealing with COVID-19, it's increased furthermore. So just a bit of a head scratcher, I guess, to remove resources from a particular area to put them back in down the road.
Member Van Andriessen, you had a question, and then followed by Councillor Huffman, or Member Huffman.
Thank you, Mr. Chair. Through you to staff, I too am questioning. I want to get drilled down a little deeper. I can see the bigger picture and the broad strokes of it, but how do you deliver the wheres and the hows of it? When we talk about mental health and addiction services, and we're looking at acquiring an additional person, public health nurse, do these public health nurses go out to the situation? I'd like that explained a little bit more, because that's really important, because in both the mental health and the women's situation, they're not always going to come to you. You have to go look for them. So how is that going to work, if I could get a brief explanation?
So, Mr. Chair, through you to Councillor Van Andriessen, I'd be pleased to answer that question. Our homeless prevention services team is a community-based team. So they are out in the communities of Haldimand and Norfolk daily at our emergency housing sites, also meeting with people who maybe are in other temporary housing, people who are living on the streets, and are engaging with people. So the plan to add the public health nurse is to make that nurse part of the community-based mobile team of housing support workers, so that they can be out in the community meeting with people where they are physically located, in order to do those kinds of assessments and engage them in services. So it is not meant to be a program where we expect people to come to an office. In terms of the Women's Health Collaborative, as Mr. Shaw said, the purpose of the public health nurse would be for public health to take a leadership role in engaging with all of our women's health services providers, and in a collaborative way, in order to identify where the gaps in services are and collectively try to fill those gaps. And again, if that means going out to those community-based agencies, then provided it's COVID safe to do so, of course, that is how we would deliver the services. Similar to how we deliver other types of community-based services, like Healthy Babies, Healthy Children, our public health nurses are often going out to people's homes.
Right. The issue with the mental health and addiction services is one that is really important to me, because people fall through the cracks. You have to hunt them up, and I'm concerned with, and we have a large area to work with Haldimand and Norfolk. So if we look at the parameters of our county, it's a big area, a big zone. Do you feel that you're going to be able to, I guess I have to say, make a dent in really what's going on, because it's so significant, the issues that are out there, and we need to help as much as we can and as much as we can afford to, but it is so important. So I'm hoping that in creating the program, that we don't miss steps, that we don't miss people out there, because like I say, they're not going to engage with you. These are people that you're going to have to hunt out. So I'm hoping that the program is set up that you can do that kind of searching and find those people that really require the service.
Mr. Chair, through you to Councillor Vanden Drieschie, our current homeless prevention team consists of 4 staff, and they are going, besides working in our emergency housing locations, they go out to places like, you know, for example, we have received reports of someone living on a piece of the trail system. So our staff will go out on the trail and engage with that person who is staying in a tent. Or if we receive a report that someone has been sleeping on the front porch of a local business, we go to that business to try to find that person and engage with them. So our homeless prevention staff are already working in the community, I think, the way that Member Vanden Drieschie is suggesting. And this proposal is to add a public health nurse to that existing team that is already going out into the community to engage with vulnerable people, so that we have someone with a clinical background that we can add to that team. So our housing support workers are very knowledgeable and very skilled in issues of homelessness, addiction, mental health, community support services, but they are not clinicians. And we think that it would be beneficial to add a public health nurse to this team through the one-time Ministry of Health funding as a pilot to see what kind of difference that can make.
Well, I'm sure it will make a difference, and I'm behind you all the way. Excellent. Thank you.
Okay, thank you, Member Huffman, and we have Board Chair Chop on deck.
Thank you, Chair Van Passen. Through you to staff, I'm in support of this in 100%. And obviously, in terms of social services, when you can bring the services to the recipients who require these services, you get your best results, and it's clearly best practice. 2 questions. One is, when we're talking about the advocacy for women's health, where does it fall into the criteria of these positions in terms of the sexual health aspect for women? As we know that there was a cut to that program was changed. So how do women currently in our community access the resources to sexual health?
Yeah, thank you through the chair to member of Board of Health. So currently sexual health services, like the clinical services, they are available through the family health teams in Norfolk as well as in Haldimand, in addition to providing services by their family physicians. For the preventive services as a health unit, we are also providing like education and some kind of contraceptive pills within schools as well. But primarily all that, like in terms of clinical services, they are provided by the family health teams and the family physicians.
Okay, so what if an individual that we're looking at doesn't have access to a family doctor?
So, Mr. Chair, through you to Member Huffman, that is where the sexual health services offered through the family health teams have picked up that service that was previously clinical service that was previously provided by the health unit. The purpose of the Women's Health Collaborative Project is to supplement that because of gaps in service that really came to light through COVID-19. So we feel that there's a role for the health unit to play with our community partners to be able to coordinate those services for women, particularly vulnerable women, and make sure that everyone is able to easily and seamlessly access the clinical services that are out there in the community.
Okay, thank you very much. I just wanted to make sure that we were still accessing that family health team, that those clinics had taken that over. I guess my next part is where I'm concerned is currently right now you'd have to be your head in the sand if we didn't realize that there was a mass exodus from the nursing profession. And COVID has certainly brought out a lot of the weak links to this matter in terms of nursing in our healthcare system. So how confident are we that we are going to be able to provide bodies to actually fill these positions? Because if I remember correctly, there was funding available through the province for school nurses during COVID, which to my knowledge never materialized. And I don't mean, and I'm not pointing a finger here just in Haltom and Norfolk, to my knowledge, they never materialized anywhere. So I don't know if that was lack of bodies to fill these positions or what happened with those. So how confident are we that we can find individuals to fulfill these roles?
So, Mr. Chair, through you to Member Huffman, we work with our Human Resources Department to post and fill all of our recruitments. We have, yes, during the crisis state of COVID, there were real challenges in terms of recruiting nurses. Certainly, I am confident in our ability to recruit nurses for these positions, and I would invite Syed to share any other additional information that he might have. But I think that these are new opportunities. I think that they're being pilot projects. There's an opportunity here to really chart some new ground. And I think that could be interesting and attractive, maybe to people who are looking to try to practice a different type of nursing or enhance their nursing practice that they used to before, particularly if they're looking to practice more out in the community with a community-based team like the homelessness team.
Thank you, Heidi. If you had more, sorry.
Yeah, thank you, Heidi. And through the chair, I can add through our recent experience with the recruitment. So we are seeing an uptake of we are being successful in recruiting nurses for some of the vacant positions for the health units. So I'm confident that we are going to fill those positions.
Perfect. Thank you very much.
That's good news finally. Chair Chop.
Thank you, Mr. Chair. Thanks, Heidi. You've answered all of the questions. I see the reporters are back in council chambers here, and I just want to make it very clear what's going on because I think there's a lot of confusion I'm hearing around the room. So we are not rehiring the same position that we had previously. The Women's Health, Sexual Health Services, when on the recommendation of our former general manager of public health, when we eliminated that position, it was because one, of a change in ministry funding, but also the recognition that they could provide those services at a better cost to the taxpayer through the family health teams. And Heidi, I don't know if you can remember the cost per visit that it was going to cost the taxpayers to maintain those services in-house, as opposed to putting them through the walk-in clinic with the family health teams. But I think it was on the order of what, $300 to $400 a visit?
Mr. Chair,
I can't remember off the top. I'm sorry to put you on the spot with that, but
yeah.
I know it was significant when you looked at the cost, and that was why we did that, because they could provide that at a better rate.
Mr. Chair, through you to the mayor, my recollection is that is correct. I don't know the exact dollar figure difference. We could certainly pull the previous report and look that up.
Okay. And so, and again, I mean, I just said this and you've clarified it, and it's certainly written down in the report. But just so that we don't get anything misprinted here in the newspaper, that the difference previously is it was partially funded by Norfolk County taxpayers at a local level. Now what you are requesting for this coordination with these additional teams, that is entirely provincially funded. So that is not an increase to the levy, which is what we were going to see previously when there were changes to provincial funding, which was the reductions that the Ford government had brought in.
Yes, that's correct.
Okay, thanks so much.
And also, I think, Heidi, you mentioned like there are changes with NDH, the shifts. Yeah, everybody blames everything on COVID, but there's been shift in the overall healthcare system at the provincial level that affects Haldimand and Norfolk. And, we've recognized some gaps and we're asking the province to fund a way to fill those gaps. Do I grasp that concept correctly?
Mr. Chair, that is correct. And just to be clear, we are not looking to take back any of the clinical services from the family health teams. The Women's Health Collaborative is meant, again, in the spirit of integration. Our two pilot projects are really linked by the spirit of integration, that we are looking at how to better integrate and coordinate these two types of services for members of our community, particularly those most vulnerable.
Okay, thank you. And seeing no more questions, is there a mover of the staff recommendation or anybody want to offer alternative? Or Member Huffman, Member Taylor. Discussion, all in favor? That is carried. Thank you, Heidi and Sahad. And I forgot to get a motion before to approve the minutes of March 1st. Are there any errors or omissions? Did I get a mover and seconder to adopt the minutes? Member Van Andriesch, Member Michelli, all in favor? That is carried. Are there any general announcements for the Board of Health? Seeing none. Can I have a motion on, I have a confirming bylaw. I have a motion on bylaw 2022-06 as BH being a bylaw to confirm the proceedings of the regular Board of Health for the Haldimand Norfolk Health Unit at this Board of Health meeting held on the 5th of April 2022 be approved, signed by the chair and the board clerk and affixed with the corporate seal. Is there a mover and seconder? Member Columbus, Member Rabbits, all in favor? That is carried. And a motion to adjourn. Member Huffman and Chair Chop, seconds. All in favor? That is carried. Adjourned. We'll be back at 3 p.m.